The community of Madrid has 33 hospitals spread out over a 3,000 square mile area. These hospitals give assistance to over 6 million people in 179 towns. Madrid's government, in the hands of the Popular Party since 1995, has adopted a private financial initiative in areas such as health, education and social services. Privatization is being contracted under the cover of outsourcing for most of the non-essential services such as administration, cleaning or food service, with the added guarantee that citizens will not suffer the consequences. In 2007, former President Esperanza Aguirre opened the first public hospital in Madrid, run partly by private management. Only medical staff and nurses remained as public workers. Since then, another 5 hospitals have taken the same steps, justified by a theoretical economic efficiency.
Some of the private hospitals, or those with government concessions in Madrid, are more expensive than public hospitals with the same level of benefits for the patients.
On October 31st, one man, Madrid's health minister, triggered the outrage of doctors, nurses and other workers in the public hospitals. Full management privatization was coming for 6 public hospitals, plus private management for the non-medical service of another 40 health facilities in Madrid area. One of the first hospitals where protests began was La Princesa. This hospital, serving a population of 350,000 people, would be turned into a specialized geriatric hospital under private management.
Because many of the doctors that right now are working at those hospitals are going to be sacked, and it's pity because lots of them have ongoing projects that have been going for years.
How come overnight you can turn down years and years of investigation and practice of several departments which are referral center for all over Spain and well known globally.
In the hospitals that are going to be privatized, there are around 6,000 to 8,000 public sector workers who are going to lose their jobs. Some of them will be lucky enough to be hired again by the new business entity.
After many weeks of daily protests, Madrid's government decided to reconsider the future status of this hospital.
The Princesa Hospital isn't closing or being dismantled but improving. It's going to be a referential hospital in everything related to the care of the elder, and it's going to be a hospital that will still tend to the referent population.
On November 26, the entire health sector, 75,000 workers, went on strike. They all claimed salary cuts, relocation of doctors, and dismissal of non-medical staff were the causes. And they also protested against the privatization of public health system.
A solution for the moment, but in 2 or 3 years it will be more and more expensive than now. We have fewer nurses, we have fewer payments, fewer salary, and we demand to keep at least what we have now.
All privatized hospitals reduce considerably their staff, the number of doctors, nurses, or technicians, and the quality of the professionals. If there are fewer professionals, quality in health insurance shrinks. They also want to obtain profits with the assigned budget, and this profit is not reinvested into health assistance, and therefore the quality drops.
Over 70% of doctors have adhered to these strikes since their beginning. Now, 3 weeks later, doctors continue the strike, but more forms of protests are supporting these anti-privatization moves, such as a collection of signatures in the population and massive demonstrations taking place on Sundays, supported by the rest of the health workers and citizens. Last demonstration held on Sunday 16th of December stamped a picture of a white tide of thousands of workers and public health users of Madrid out in the streets of the capital, protesting against the restructuring plan announced by the community of Madrid.
They keep arguing that what they want to do is to save money, but the first thing we have proved is what the changes that they want to make is going to cost the community more than just the system as it is. And there are things that have been changing during the last years that have been proved to be more expensive.
If things don't change, and Madrid's government continues to implement this progressive privatization of the public health system, doctors will continue to protest for the proper treatment of the patients, because after all, as the doctors say, This is all for the citizens of Madrid.